Hi, my name is Alexandria Madrid, and this is my persuasive speech. Imagine you are a vibrant, lively person with the world at your fingertips, living a life full of family, friends, adventure, and opportunity. You have secured a great job, a wonderful spouse, created a beautiful family, and have made memories and moments that anyone could envy. You are living the dream. Now imagine that dream has suddenly and unexpectedly turned into your worst nightmare. What was thought to be a practical and common ailment has quickly turned into a terminal disease. You are given 6 months to live at best to finish out this great life that you have created for yourself. But with this 6 months will come excruciating pain, possible embarrassing moments, tears of a dream cut short, and a family who has to stand by, helpless, while they watch you deteriorate. You think it would be better for all involved to just end your life on your terms, safely and well with a thought out plan, but that is not an option for you. The question is, should it be? My stance is yes. Over the next few minutes, I hope to inform and educate you on the following. 1, what assisted suicide is. 2, the personal, emotional, financial, and economical benefits to legalizing the act. And finally, why it should be legal in all 50 states and how each of us can help to achieve that. First, what is assisted suicide? Physician-assisted suicide is described as a suicide undertaken with the assistance of another person, typically assisted by a doctor or other licensed medical professional. Currently, only 8 states in the United States allow physician-assisted suicide: Oregon, Montana, Washington, District of Columbia, Hawaii, Vermont, California, and Colorado. And to qualify for this, a patient must be given 6 months or less to live, be of sound mind and body, and have a terminal illness that has no chance of recovery. How is a physician-assisted suicide performed? It's done by the care of a medically licensed professional. The patient is usually given a cocktail of prescription drugs by way of lethal injection in most cases. Drugs can be administered in hospital, hospice, clinic, or home settings as long as areas meet the standards of sterility and safety for all involved. Once death has been determined, all standard procedure of body removal and preparation for burial or cremation services take place, and the family can do what they please. Assisted suicide or assisted dying. Many are trained to feel the word suicide as a dirty word, filled with negative connotations and morally and ethically wrong. I am not here to discuss ethics and morals. I am simply providing an insight. Many patients prefer the idea of assisted dying because, keep in mind, they have been given a death date for all intents and purposes. They are dying sooner than anyone thought or planned, and nothing medically can change that. Their choice to end their life on their own terms is not for lack of resolve. It could be argued that it's dying with dignity. Now that I have shared with you what in fact assisted suicide really is and the process behind it, I will inform you of what I believe to be the benefits of legalizing physician-assisted suicide. Why should that be a patient's personal choice? You're given choices in every other aspect of life from the moment you understand that you have free will. You should be able to have a choice in how you die as well. Regardless of sex, race, religion, upbringing, economic background, at the core of it all, we are people with thoughts, feelings, and understanding. We should have the power to say what happens to our bodies on our own terms. There's also an emotional tax that terminal illness has on an individual. Terminally ill patients have a higher rate of depression, anxiety, fatigue, loss of appetite, feelings of helplessness, feelings of burden, and desire to speed up the inevitable. According to an article written by Healthline, terminal patients are 4 times as likely to develop depression as their non-terminal counterparts. There's also a financial statistic regarding hospital stays, hospice cares, and medications in regard to terminally ill patients. The average cost for a hospital stay, which is 1 week for a terminally ill patient, is $15,000. That's from information provided by debt.org. On average, hospice care costs roughly $200 per day. For a terminally ill patient to live the full 6 months they've been given, that would cost the family upwards of $36,000. On average, these stays and the cost of medicines prescribed for pain management, body continence, and mental health that may arise after diagnosis can go into the upwards of $80,000 for the family. There's also economic effects from a taxpayer standpoint with regard to care for uninsured patients. According to an article written for KevinMD.com, in 2010, Medicare spent $55 billion in medical care for terminal patients during the last 2 months of their lives. Medicare is paid by and funded by taxpayers, and each American pays 1.45% of each paycheck into the Social Security Administration. I don't share this
May
information
I
to
have your
illustrate a
attention,
price
please?
tag.
If you want a library.
I don't share this information to illustrate a price tag on a person's life. That's not what this is about. All life is priceless and should be seen as such. However, these numbers are quite relative in regards to the topic at hand of legalizing physician-assisted suicide. These numbers need to be reflective to you or the persons who prefer the option of physical assisted suicide, but are forced to see each dying day through because the government has told them that they cannot decide for themselves when it is okay to die. These numbers reflect the burden that the families of such patients have to endure, all because a written law says that they cannot do anything otherwise. With that information, I am now going to share with you why I believe physician-assisted suicide should be a legal option to all people. All people in all 50 states of the United States of America have the right to autonomy, which is the right to make decisions for one's own life and body without coercion by others and respect for one's decision. We as people have the right to decide whether to vaccinate or not vaccinate our children or ourselves, even though there is substantial proof of the benefits to the people as a whole entity regarding eradicated diseases. Women have the right of pro-life or pro-choice due to a 1973 decision of Roe v. Wade. You can't burn the candle from both ends. If you feel these two examples are prime examples of things you as a person should have control over, why is your death any different? Next, there's a Death with Dignity Act. In 2008, Washington passed the Death with Dignity Act, which allows all terminally ill patients the ability to determine the time of their own death. Death with Dignity has a website which provides access to all legislation in all 50 states. This gives us all the ability to have our voices heard on whichever side of this topic we sit and allows the progression of death with dignity to all 50 states. To conclude this speech, I have now informed you about the bare basics of what physician-assisted suicide is, how it affects patient, family, and friends from a personal, emotional, financial, and economical standpoint, and have given many reasons as to why I believe it should be a legal, valid option to terminally ill patients in all states across the country. If you want to explore the topic further, I highly recommend this book called The Right to Die by Anne Wallace Sharp. Available at most local libraries, it provides a more in-depth view into assisted suicide, euthanasia, the dying process, and also gives resources to organizations to contact. I'm not asking you to believe in the right to kill someone. I'm asking you to believe in a person's human right to decide what is best for themselves and their bodies without outside coercion or judgment. We all have the right to live our lives, build our dreams, and create our destiny. And when life throws us our worst nightmare, we should also have the right to decide when that nightmare should end as well. Thank you for your time.